Pennsylvania is one of the leading states leading the nation when it comes to cases of COVID-19. NBC 10's Deanna Durante tells us now, with hospitals filling up and a sagging number of staffers to care for patients, some patients are dealing with longer wait times.
We're not waiting for a table in a restaurant where you could say, you don't have enough waiters and waitresses.
Frustration from Bensalem's public safety director.
This is an injury. This is a mental health injury.
For 3 hours Thursday evening, Bensalem police sat with a patient inside the Lower Bucks Hospital emergency room. The man was sent there for a mental health evaluation, but the wait time was too long.
And in this particular case, the officers had to let the individual go.
Fred Heron says the time ran out on the man's involuntary hold.
The police ended up taking the patient home.
Lower Bucks Hospital is aware of the incident and says the issue is partially due to COVID trickle-down.
It's COVID cases again, they're rising. The cases are rising again.
And staff has been shrinking.
Sometimes the facilities don't have the staffing for us to be able to take those patients to the facilities. So they are here with us for a prolonged amount of time, which unfortunately backs up our ER.
The Pennsylvania Department of Health cited 24 long-term care facilities last month, according to its November report, citing in many cases a lack of staffing to provide for patients. And when it comes to staffing hospitals, Pennsylvania Governor Tom Wolf has asked FEMA to provide aid for hospitals and other facilities that are becoming overwhelmed. In the meantime, hospitals are asking for folks to try and help ease the strain.
Some people are using the ER as their primary physician.
She also says Omicron fears are pushing people with mild symptoms for emergency medical attention when it's not always needed. Some hospital systems have been reporting staffing shortages since the fall, and Rodriguez says the COVID trickle-down is jamming up ERs nationwide.
It is definitely not just a Lower Bucks issue.
And the impact is more than hospitals.
You're tying police officers up. So now they can't be going out doing their job because they're sitting in a hospital waiting room for 3.5 hours. When people call 911, we have to respond.
Which is why hospitals are asking you, use emergency rooms for emergencies. If you have mild symptoms, stay at home and isolate. While cases are occurring in vaccinated individuals, they say they're not as seriously ill as the unvaccinated. Rodriguez reminds you, get that vaccine before the height of flu season arrives. Deanna Durante, NBC 10 News.